I didn't really know what to expect this morning, so I might come across a little scattered, but I have a lot of thoughts on this. So first of all, my name is David Mitchell. I'm a resident of the city of Arvada and the EMS chief for the Arvada Fire Protection District. I've been in EMS for 20 years, and it's been my honor and privilege to serve patients in my jurisdictions the entire time. It's been an incredible experience. The Arvada Fire Protection District is a quasi-governmental agency that's separate from the city of Arvada. It serves 122,000 people over approximately 41 square miles. In 2019, we had 13,690 total patient interactions, and by far the highest, well, I shouldn't say that. The second highest group or subset of those patients is mental health, behavioral health patients. We had 1,457 mental health contacts. That represents more than 10% of our total call volume in 2019. Mental health patients, behavioral health patients, are transported more frequently than non-mental health patients. Our average of all patient interactions results in 63% of them going to the hospital. Mental health patients, 89% of them go to the hospital. And so I say that statistic in order to impress upon you that it is a resource-intense interaction. Our ambulances are our busiest piece of apparatus, and they are called on any number of things. You can imagine, as you all probably know, 911 is, I heard some people use the term safety net. 911 is the ultimate safety net. If people don't know where to turn or what to do, 911 is their answer. And we will, anybody that's ever, had the misfortune, I suppose, of having to use 911 is that somebody is going to show up. And we will always show up. And we do our best to overcome the challenges that we face when we get there. Mental health patients and behavioral health patients represent a unique situation. And I want to just basically tell you a little bit about what we're currently working on in order to try to solve the problem of one mantra that anybody in the healthcare field will recognize is that we try to provide the right treatment to the right patient at the right time, in the right place is something that we've added. The entryway to the healthcare system by calling an ambulance and going to the emergency room is the most expensive and potentially least effective mode of intervention for these patients. We have no other option. When somebody calls us and we take them somewhere, we're regulatorily and statutorily obligated to go only to the emergency room. One of the things we're working on, we happen to live in a progressive city with a police department that's very progressive, and they employ, in conjunction with a partnership with Jefferson Center, 2 co-responders, mental health co-responders. And they help to alleviate some of or take some subset of those mental health patients and provide them another avenue for treatment. I'm hoping that we build on that to make it more robust. We're working closely with our police department to develop a novel solution that would do a better job of not just taking these patients to the emergency room where there's often not somebody to see them in a timely manner. And then it's not uncommon for us to pick up a patient who's in crisis, who's been placed on a 72-hour hold by the police department, go to the emergency room, have them evaluated to be determined that there's no life-threatening situation playing out, and they're let go, they're released, and we'll run on that same exact patient, still in crisis, that same night. And it is a travesty. So,
Dave, you just 1 minute.
Okay, I'll get through this last little bit here. We're trying to navigate the various statutory regulatory environments that exist. The addition of the M.5, which is, maybe has a little bit lax guideline as opposed to the standard M1 72-hour hold, has not been widely adopted by police agencies. It seems like there's some confusion as to what they entail, and it still does not solve the problem of us having to transport them to the hospital. One thing that could be instrumental in changing the way this works is giving us the ability to transport other places. We would love to be able to work closely with our partners at Jefferson Center to take somebody who's in crisis, perhaps not in an ambulance, which is the most expensive mode of transport, to the crisis center where they will not receive a bill, for their treatment. But right now, we cannot do that. And so that's the one thing I'm asking for, but just know that we're working on it. Know that we'll come in the meantime, and know that there's a better option out there if we can all figure out how to work together and get there. So that's what I've got. I'll leave my card. Thanks.
Thank you very much.